So I'm going to start big picture. I didn't know much about the universe beyond Earth, so I started with Earth. I know they're looking on Mars right now, but I don't know what the healthcare is like there. So globally, and I've mentioned the World Health Organization before, but they're a body that does look at global health, so in all sorts of different countries. But if you actually look through what they recommend and what they're talking about at that level, they're actually saying, patient involvement and engagement should be happening everywhere. It's not just in places like Canada or where there's universal, it should be happening everywhere. And here's some of the recommendations that they have. So consideration of things like patients' rights, and charters just sort of means that, a list of what patients can expect from their care, what are the rights of patients. Just even thinking about this is very different than historically how patients were considered. That patients should actually have feedback on what the quality of their care is like. So we shouldn't just be grateful that we got it. We should be giving feedback so that the healthcare system can learn, what has the experience been like. We need to actually have access to health information, so when we're making decisions about our care, we should be able to expect that we will be given all of the information to make an informed choice. There should be things like, now this is recommendations, we do not have this yet, but patient portals, or I won't say the word e-health, but I just did, some of these things which we've heard about, but we don't necessarily have in place yet, but these are recommendations. Healthcare professionals should be trained not only in their expert medical skills and clinical skills, but also in how to communicate and also how to interact with patients, because that actually, if you look at research, that actually can have almost the most profound effect on care, is your interpersonal skills, or the skills for communicating with people. And I think we're all here today, self-care education, and that sort of integrated into all levels of healthcare delivery is absolutely essential. And that we should have aids for learning. Healthcare literacy is a term that's used for how well a patient can understand all of the medical terms, all of the care treatment plans, things like that they've been given. And health literacy can vary very much between patients, but basically what they're saying is we should consider when we're talking to patients, have we made it clear what is their level of health literacy, how can we help them improve their health literacy? All of these things are being considered. It's actually making for a much more complex set of considerations in healthcare than historically, but it's actually, it's quite amazing, I think, that it's happening so much all over the world. So then if I bring it back down to the level of Canada, I've just chosen an example here of one of the many things that are going on within Canada that I think reflect this change in how we actually are looking at healthcare. Choosing Wisely Canada actually came out of a broader initiative which was going on in the UK and in the States, but is basically a campaign to help patients and physicians engage and to have conversations about the tests and treatments and procedures they're having. So as opposed to the physician or the health provider just making a choice about what the patient should have, this is about actually involving the patient in that discussion and actually questioning sometimes what is being prescribed. And there's also going to be a link supplied on this YouTube channel at during this presentation. So Choosing Wisely Canada, as I said, was basically an initiative which is about helping patients make informed and smart and effective decisions about their care. And on their site, they actually supply accessible, understandable information about what types of tests you should question, things like having, let's say, a mammogram or prostate screening, things like that. How do you make a choice, or how do you talk to your physician about those kind of things? So this whole site is all about bringing together providers and patients in conversation. So I would say change is happening here today. And you guys have all experienced it with the Toronto Central Self-Management Program. What I think is really especially exciting about this program is this concept of peer-led healthy behavior change, which I think is something that's really key to the change in healthcare, is that patients themselves are becoming experts in their care, and they're learning so much that they're having the ability to share with others and back with the healthcare system what their experience is like, what they've learned. And these self-management workshops are also available to healthcare providers, because if you think about it, it's about changing not just how patients interact with the healthcare system, but it's changing how providers and the system itself works, and how they respond to patients and how they help patients, right? I think of it as a relationship. It shouldn't be one-sided, the change. It should be both sides coming together. So we have to consider how to help and support both sides. So being a patient actually looks quite a lot different today. But I think if we think about that acute model where it was about fixing that individual problem, we're now talking about things like managing and talking about your well-being. So not just that cure or that fix, but talking about how are you doing in terms of your daily living or your quality of daily living. Participation, how sustainable is your care? This is a much longer term, and as you see, is a cyclical type of experience. So actually, one of the interesting things here, I think, though, is that this is a very empowering, I think, and it's a very exciting change for patients. I think it can, there's a term here, self-advocacy. I think basically it can help you feel more in control of things and empowered. However, it actually also comes with a lot of responsibility. And I mentioned this before, but I think that's a very important thing to consider. Sometimes it can feel actually rather overwhelming to be involved in your own care. And again, I said that when I Googled patient engagement and activation, it was sort of a romantic view of it, but I think we also want to consider that when you're ill and when you're not feeling well, it actually feels like a big onus or sometimes a big task to actually engage and be active and ask for what you need and look through all the resources. That's easier said than done, and it actually that's why I think we need a lot of support, and that groups like this are really important, because it's difficult to do that on your own, and it's also difficult to do that when you're feeling weak or you've been drained by whatever it is that you're dealing with. So it comes with two sides, this whole this whole engagement piece. We also actually, another difference in healthcare today that I'm sure many of you can relate to is this concept of actually almost being bombarded with information. So it's great that we're going to be informed and we're going to share in decision making, but wow, that's just, sometimes you just want someone to tell you what to do, because it's hard to feel like you need to be the one who makes a choice and then bear responsibility for that choice. I've experienced that in my care, where sometimes I just thought to the doctor, wanted to say to the doctor, just take me and just fix me. And as we just went through, it doesn't really work that way when you have ongoing problems. But when you're tired and when you feel drained, that is actually sometimes what you want to do or to say. And also, when you have access to all this information, it can actually be overwhelming and scary. Which information is good? How do I know, what to use? And hearing different messages. I'd say, I love this cartoon that it's true. I work with doctors, and the doctors do say, my patients bring me printouts from Google and say, look, I know what's wrong with me and this is what's happening, or the other thing that people say is I looked up my symptoms and now I think I have whatever it is, this horrible, terrifying thing. Whereas maybe, had they actually talked to their doctor in the first place, they wouldn't have had to go through that anxiety. So again, it comes with, it's a double-edged sword, or it comes with pros and cons. Great, we have access to all this information. We can be empowered to make choices and to learn about our own health. But also, that information can feel overwhelming and can sometimes send us in the wrong direction. So in sort of summary, there's lots of new opportunities for engagement, for advocating for yourself, for being empowered, right? But there's also, new challenges, and there's new obstacles to overcome as well, which is where I think putting more heads together and thinking through doing some problem solving and sharing what works and what doesn't with each other is really, really helpful. It's about us thinking and brainstorming together and us individually understanding what works best for us. So hopefully what you take away from today is a little bit about what might work for everybody, but also learning a little bit about, okay, but I personally, this is how I want to approach things.